These are the most important vocabulary words for Chapter 13. Advanced life support, or ALS, is just advanced life-saving procedures. So this is things like starting IVs, cardiac monitoring, advanced airways. So ALS skills in Montana start at the EMT endorsement level. So as an EMT, you will not be ALS, but if you get some of these endorsements, you can provide some ALS skills. EMTs are BLS, or basic life support, and this is just all the non-invasive emergency life-saving care, using a BVM, doing CPR, using an AED, those kind of things. Cardiopulmonary resuscitation, CPR. It's the chest compressions and the rescue breathing that we do for a patient that's not breathing and has no pulse. Dependent lividity. So this is a definitive sign of death when the blood settles or pools to the lowest point of the body. So you'll see like a blue discoloration. If they're laying on their back, it'll be on their back. And this is a definitive sign of death. So if your patient has dependent lividity or three other signs, you won't start CPR. That's true for dependent lividity, rigor mortis, putrefaction, and just non-survivable injuries such as decapitation. Gastric distension is when air fills the stomach. This can happen when you're using a BVM if you ventilate with too high of a volume or too quickly. Hyperventilation is breathing fast, rapid or deep breathing, breathing too much. Ischemia is reduced blood flow, specifically to a certain part of the body. So like a blood clot causes ischemia, reduced blood flow. The recovery position is laying a patient on their side, usually their left side. And then we use this to protect the airway in an unresponsive patient who has a clear airway and no head, neck, or back injuries. So if they're not breathing on their own, we can't put them in the recovery position because to monitor their breathing, they need to be supine. If they have a head, neck, or back injury, we don't want to move them from the position they're in, so we'll leave them as they are. So if they have no head, neck, or back injury and they're breathing okay on their own, we'll put them on their side. We call that the recovery position. ROSC is the return of spontaneous circulation. This is our goal of CPR. It's to get the pulse back in a patient who was previously in cardiac arrest, meaning they had no pulse. So when we get the pulse back, we call that ROSC, return of spontaneous circulation. Rigor mortis is another one of those definitive signs of death. It's when the body's muscles stiffen up. So if you see the joints stiffen up, we don't start CPR. It means they've been deceased for a long time. That's it.